All right. Hey, everyone. Thanks for joining us for another session on virtual shadowing at Hearts for Health. This is going to actually be our last one to wrap up the semester. It's been quite the semester. A lot has happened, but we're glad that y'all have joined us over your winter break for this last session. Today, we're joined by Dr. Shiven. He's an internist with fellowship training in integrative medicine. This is a field we haven't seen yet on shadowing, so I'm pretty excited to have Dr. Shiven join us, talk about the field. We were just talking about it earlier. Even some physicians don't really know about it. So it's definitely a great glimpse into medicine that we're going to catch today. For those who are new to our program, I do want to have a few reminders for y'all, just so you get a little familiarized with how our sessions typically run. So we have speakers who join us from a variety of fields, and you'll get to know about those fields as posted on our Instagram page. We have flyers that are posted ahead of these sessions. They could be in medicine and dentistry. They could be PAs, nurse practitioners, so a variety of fields. And at the end of each of these sessions, we do have a Q&A. If you have any questions for Dr. Shiven, feel free to type them in the chat, which is either to the right or the bottom of the video that you're watching right now. And we will go through them in the order that we receive them. So you could really type in your questions at any point during this session, and we'll get to them all later. It's not necessarily like you have to type them in just at the very end. So that's one thing to keep in mind. Also, for those who want to stay tuned with more shadowing sessions, if you're not already familiar, like I said, we do have an Instagram page. That's where we post our flyers, and that's where many of them go up for our upcoming sessions. We typically will post them a few days or the week before the session begins or is scheduled for. We also have an email listserv. So that's really just the email version where we attach flyers, we include opportunities also for our other programs outside of shadowing. Again, they're all for our pre-health students out there. All of our programs are free. The other programs have to do with mentorship and volunteering. So if you happen to be interested in that, you'll be in tune with when those applications and when those opportunities are released over our email listserv. There's two ways to join our email listserv. You can either subscribe on our website. Our website has a subscription form at the very bottom of each web page. You can fill it out, click send, and you'll be good to go. Or you can just email us at shadowing.h4h@gmail.com. That's our email address for any questions regarding our shadowing program. And it's also the email address you can send over your name and preferred email address to join our listserv. Either of those two ways does the same thing. It gets you added onto the listserv if you're interested. And if you have any questions, you can always feel free to email us. But those are all the reminders I have. If y'all have any questions, like I said, feel free to shoot us an email. I don't want to take up too much time, though. So Dr. Shiven, feel free to take it away.
All right. Thanks, Michael. I think in the introduction, you kind of mentioned that a lot of people don't know about integrative medicine, which I find extremely true because it's an up-and-coming field. But that said, it's funny because integrative medicine has been around for so long because the core components of integrative medicine is to use our ancestral knowledge, and is also to fine-tune nutrition, physical movement, which I think in this day and age sometimes doesn't get the limelight that it should. I have some photos here. These are dishes that I actually made myself. Very proud of that. When I was in training, I had no time to cook, or at least that's what I told myself, and I ate complete garbage all the time. So when I got in tune with integrative medicine, it was a life-changing experience because the idea was to use food as medicine. So here to the left, I actually have a kale salad, which we make with our clients and patients. We concoct this with a dressing that's made in-house. We really are very mindful of the way that we eat because we take our time with food, but we also take the time for preparation. We'll actually rub that kale down with our hands and really massage the dressing onto it. Here's another type of salad with a lot of different vegetables. We have cabbage, we have radishes, we have bell peppers, we have some sesame seeds on it. On the right here is what is called an endive ceviche. It has shrimp in it and some sprouts on top. So this is really kind of goes to show if I can cook, probably anybody else can cook as well. You don't have to be a chef to use food as medicine, and that's what I tell my patients. Now, before I get into the actual lecture, I wanted to tell you guys my own journey to integrative medicine because I think that's worthwhile. When I was in medical school and also residency, and I'm an internal medicine physician, as Michael pointed out, I had no knowledge on herbs, on botanicals, on also nutrition. I had no clue how to counsel my patients, to be quite honest with you, because we get very minimal training when it comes to those things. For me, when I was doing my ICU rotation as an intern, my mom, who is a yogi, she's attuned to Reiki. She told me I was really, really stressed, as you could imagine. We used to do 30-hour shifts. I don't know if that's something we still are doing or not, but we used to do those 30-hour shifts in the ICU. And I was in Los Angeles at the time, and my mom suggested, hey, you're so stressed. Why don't you try a Reiki class? I had no idea what that meant. So first I had to Google it. And after that, I did the most LA thing ever. I Googled the first bougie LA Reiki studio, and I went for a session. Now, when I first entered the studio, the lighting was just right. The music was meditative. There were a lot of people that were there for one purpose, to make their health better and feel better. And I still remember we sat in a group in a circle, and there was the Reiki practitioner that introduced herself. And then we were going to do something called touch Reiki. So as the session started, the Reiki practitioner came and she put her palm over my chest. And just for a few minutes, while all the meditative music, the nice lighting was on. She moved on to the next person. She puts her hand over the top of the lady that was sitting next to me, over her neck. And after this was all said and done, we had a little debrief at the end. And the lady that was sitting next to me says, I've had chronic cough for all my life. And this was the first time that I didn't cough, and it's been over an hour. And of course, as somebody who is a student of science and medicine, I walk out of that studio and I'm like, what a scam. How can somebody's touch fix your chronic cough? That is just not possible. This is just a complete scam. So I didn't think much of it. Next few months passed by. I got an upper respiratory infection. And my mom says something very, very interesting to me. She said, why don't you rub some warm coconut oil over your neck? And I said, why? She said, when you were a little kid and you used to get upper respiratory infections, that's how I treated your cough. And at that point, there was just this switch that flipped over. I said, a few months ago, when the same thing happened, when two random people who probably didn't know each other, someone's touch fixed somebody's cough, and my mom has been doing it all along. And nobody can argue that a mom's touch to the kid is therapeutic, right? I think there's a lot of evidence that's compiling about therapeutic touch, and especially in that skin-to-skin contact when babies are born. So it was just a eye-opening experience for me. And I told myself, hey, I should really look into these things. Maybe they have some value. And that's when my own life experiences, I started recounting when grandma's herbal remedies were cure for a lot of things. When I was young, we didn't, if you had belly pain, you didn't just get Tylenol and ibuprofen and all those fancy medications that we use now. We got things like a decoction of fennel seeds. We got peppermint, we got ginger, and that was common stay. And it was very effective. But somewhere along the line, I have to say, I forgot about all those things. So it was a great reminder to me during my training process. And when I realized the power of these things, I told myself, I just have to learn this and go back to my roots. So that's how I began my career in integrative medicine. Okay, these are just some disclosures for the presentation. I have no conflict of interest. These are the discussion points for today. Because I figured that a lot of people don't know what integrative medicine is, I thought I would first go over some of the things that are commonly, how integrative medicine is commonly practiced in the United States. And then we'll go to a case presentation and see how we kind of view things a little bit differently than conventional medicine. Okay, so the definition of integrative medicine, it depends on what text you look at, but these are a couple of my favorite ones, so I want to share this. Integrative medicine is healing-oriented medicine that takes account of the whole person, including all aspects of the lifestyle. It emphasizes the therapeutic relationship between practitioner and patient, is informed by evidence, and makes use of all appropriate therapies. I really like this definition. It comes from the Andrew Weil Center of Integrative Medicine, which is one of the oldest centers at University of Arizona. It takes into account a couple of things. One, it really emphasizes the relationship between practitioner and patients. I think that's one of the cornerstones. That's front and center. When you are doing an integrative medicine evaluation, you really have to understand your patient. So much so that we say that before even understanding someone's disease and pathology, you need to take time to understand the person before you can provide effective treatment. The second point I wanted to mention is informed by evidence. Now, I think this is a key point because a lot of people think, and out in the media, the idea is when you're using alternative medicine, it's all hocus pocus and there's no evidence. And what we used in integrative medicine, which is slightly different from conventional medicine, is something called evidence-informed medicine. Now, that's different than evidence-based medicine, because when I am looking at a therapy and evaluating whether or not this is right for my patient, not only am I looking at the data that we have, because sometimes the data is scant in integrative medicine, I'm also looking at the level of harm that a therapy can potentially have on a patient, right? So, for example, if I'm using guided imagery, I'm not just using the idea, okay, what is the level of evidence that we have for guided imagery when it comes to postmenopausal symptoms? I'm also looking at, when I use guided imagery, what are the side effects? What are the adverse events? And as you could imagine, guided imagery doesn't have too many, right? It's not a pill, it's not a medication, it's not an injection, it's not a surgery. So it makes it easier. Now, that said, there are things to be mindful of when you're doing guided imagery, and there are things that we do let our patients know. Of course, you shouldn't be doing guided imagery when you're driving a car or operating heavy machinery, or you might have a psychological break towards the end of it. Now, apart from those side effects and adverse events, there's really not much that goes into that, right? Okay, let's look at another definition. This comes from the NCCIH. Integrative health brings conventional and complementary approaches together in a coordinated way. Integrated health also emphasizes multimodal interventions, which are two or more interventions such as conventional healthcare, like medications, physical rehab, psychotherapy, and complementary approaches like acupuncture, yoga, and probiotics in various combinations, with an emphasis on treating the whole person rather than, for example, one organ system. Now, in this definition, I like it because when people think of alternative and integrative medicine, it all gets clumped together. Everybody, I have physicians that tell me, oh, so you're an Ayurvedic practitioner, right? Or you're a homeopath, right? You're a naturopath, right? No, I'm none of the above. I'm an integrative medicine physician. So it is not that I never use pharmaceuticals. Of course I will, right? And when it's indicated, it's indicated. And this is not in lieu. So I would never suggest a patient, hey, forego your chemotherapy and radiation therapy for your cancer. Absolutely not. That would be, and that happens in the real world, but that's because there's a lack of training and standardization. And I think that's something that we need to be mindful about. And that's why when, as an MD, you're getting all your education and then you go this route and get more training in integrative medicine, I think it's a lot better. You can do a lot with it. You can help your patients in a unique way. So who is exactly practicing integrative medicine? Well, physicians, MDs, DOs, NPs, chiropractors, naturopaths, acupuncturists, psychologists, therapists, dietitian, Ayurvedic practitioners. So there's a long list of people that practice integrative medicine. I think one of the things to be mindful of is also there's different regulatory bodies for all these practitioners. What sorts of interventions are we prescribing? So this comes from a survey study that was done in 2012 across 29 centers. A lot of food and nutrition, which I think is very interesting because I will tell you that I had no business counseling somebody on nutrition. Because when I left my training, I think we had maybe 4 hours of lecture in the 11 years that I had, going through pre-med, medical school, residency. Before fellowship, I would tell you that my patients probably knew more about food and nutrition than I did. We use a lot of supplements. That said, we know that supplements also have side effects. So it's not that we use supplements and knowing that nothing dangerous can ever happen, but when we practice integrative medicine, we do it in a more mindful way. We do it in a more evidence-informed way. Yoga, meditation, TCM is traditional Chinese medicine. The nomenclature has changed over the years a little bit. Now we're calling it more traditional medicine. TCM is an older term, but things like acupuncture is part of traditional medicine. Massage, pharmaceuticals. Massage, I will tell you, and I don't know if there are any budding DOs or if there are DOs in the audience. Manual therapy is highly undervalued and underrated. I think there's a lot that we can fix by simply getting some manual therapy, depending on what type you're getting. DOs do OMM. There's a whole field of massage therapy. So lots of things that you can use to counteract common problems. These are some of the things that we prescribe as interventions. So the first thing that has 55% based on the same study that was done in 2012. So MBSR, this is mindfulness-based stress reduction. In integrative medicine, I think it's sometimes important to immerse yourself into integrative medicine therapy before you prescribe it. It doesn't always have to be the case, but sometimes it's helpful. So I actually went through an 8-week course of MBSR myself, and it was honestly a life-changing experience. You learn a lot of different ways of counteracting chronic stress, inflammation through mind-body practices. So I think it's really helpful for some of you in the audience that have a lot of stress. I really recommend it. It could even help in your personal life, and honestly, it just becomes a little bit better when you've gone through something and when you're counseling your patients in the future. We do a lot of nutritional counseling and education, kind of mentioned before, individual counseling, meditation, yoga, cooking classes. So that's another interesting one on the list. We do a lot of that in my practice. We actually have hands-on training for people that are interested in learning more about nutrition and mindful eating. And so we'll actually make food together. And I think it's really enjoyable. It builds rapport with your patients. And it also, honestly, it really shows this connection that we've lost with food, especially if you think about these days, right? We have drive-thrus. So hardly ever we're paying too much respect to our food and what's in front of us, right? It's a little bit concerning when we are driving and on our phone, and then we have a cheeseburger in a hand and fries. So I think something's got to change, right? Journaling, support groups. Support groups are really, really great way of getting people that are going through the same ailment and really getting a lot of information and teaching, because the truth is there's something to be learned from people's experiences. And this is why I think support groups work really, really well. Tai Chi, Qigong, if somebody's unfamiliar with these, I really would suggest taking a class in Tai Chi and Qigong. It's sort of a practice that comes from Asia that involves a lot of mindfulness, physical movement, and meditative practices all combined together in one structured setting. So I really encourage people that have not tried these practices to take a class. And of course, exercise. Now, there's a difference between physical movement and exercise. Exercise is a more structured form of physical movement. I think it does not matter. We know that through research, whether you're doing a exercise routine or you're just optimizing your physical movement. There are certain exercises that have some data that are better than others. But to be quite honest, just any physical movement is better than none. And that's what I tell my patients first and foremost. So types of services, we are doing consultative care, comprehensive care, primary care. So lots of different fields that we are part of. What are some of the common reasons for visits? This is similar to my own practice. Chronic pain, of course, is a huge reason why people seek out help. And if you see what's happening with the opiate epidemic in this country and also probably all throughout the world, I think it's really, really telling and how severe of a problem this is. I want to point out that, we're always talking about herbs and botanicals and, side effects of these untested things. But I will tell you that there's a jarring data that I have to share that in the United States alone, we have 98,000 people that die of Western pharmaceuticals. And I'm not talking about medical errors. I'm talking about the right dose, the right frequency, the right medication. Everything was prescribed just correctly. And we still have over 90,000 people that die every year. Now that number is a lot higher when you look at people that are hospitalized. I actually work in hospital myself. I see this firsthand. I train medical students, I train residents. I work at University of Nevada, Las Vegas. And, this is just a testament of somebody that's been doing this for some time, that this is a huge issue. And of course, opiates being one of the main medication that is responsible for a lot of these hospitalizations. A lot of people come from gastrointestinal issue. I think gut health is very, very important. When you look at a lot of Ayurvedic texts that were written, gut health, which is also called your digestive fire or Agni in Ayurveda, if that is off, you will get downstream issues. Now, these issues result in chronic health conditions that we know of today. Of course, the Ayurvedic practitioners didn't know that back then, but we now have things like diabetes, we have things like strokes, we have things like autoimmune disorders and cancers. And I will tell you that really the digestive health is super important when it comes down to it. Depression, stress, anxiety, a lot of mood disorders, insomnia. We see a lot of those things in my practice. Again, a cornerstone of driving your inflammation up in the body. And we know that chronic inflammation leads to chronic health conditions. So very, very important. In the last couple of years, mental health has, of course, been in the limelight, but I think it's, and of course with COVID, it's gotten worse. And the truth is that we need to take this very, very seriously because your mental health is really connected with the physical health. Cancers, again, when I'm seeing a cancer patient, I think the one thing that I, tell them is that we're not using integrative medicine for curative approach. That is, your conventional therapy is going to be used for that. We are using integrative medicine to optimize your health while you're undergoing cancer treatments. We're using it for prevention, but I'm never going to promise anybody that, hey, when you get these integrative medicine therapy, your colon cancer is going to go away. Absolutely not. But what I do promise is, let's say when we're using some mind-body practices and suddenly your chemotherapy starts doing better than expected, well, that could happen. And I think that's something that to be mindful of. Stress is a commonly reported symptom that I have from most patients in my practice. I honestly can't think of a single person who's come to my practice and has not complained of stress. I'm sure you guys know this well in training, that it's just highly prevalent. And it's something that is very important. It should not be that a patient that has heart attack and then we're counseling them on the dangers of having stress and what it does to the heart. I think that needs to be talked about a lot before. That needs to be talked about young kids to adults that are going through and discovering their life. This is a constant thing. Now, when we're dealing with stress, right? I mean, a lot of people give me different reasons. They'll tell me, well, I have stress because I have a stressful job. Now, I can't tell them, hey, quit your job. I wish I could and take 2 weeks in Hawaii. I wish I could write a prescription for that. But, that's not possible sometimes. So for everything that is stressful in your life, what we're trying to do is balance it with something that is going to reduce the stress. So things like physical movement, good nutrition, mind-body practices. These are some core things that we talk about when we're dealing with stress. This is how the NIH defines complementary and alternative medicine, also called CAM therapies. They define it in 5 different categories. So the first one is alternative whole medical systems. Now, understand that these are healing methods that have been used for ages. If we compare how old Western medicine is to some of these healing approaches, we are really, really new. So Ayurveda is a whole medical system because it was made independently of Western medicine. It has its own guiding principles. It has its own physical exam. It has its own way of taking history. And it's all sort of useful because a lot of these whole medical systems, they talk about energy medicine, which is almost completely and entirely missing in Western medicine. So when I am practicing, I don't have to be an Ayurvedic practitioner to be doing integrative medicine. I can use Ayurvedic concepts and incorporate that in my regular practice. And that, I think, is a good mix. Now, if somebody wants to completely see an advanced Ayurvedic practitioner or get advanced Ayurvedic guidance, they need to go to an Ayurvedic practitioner and not me. So I use a lot of these concepts from naturopathy, from homeopathy, Unani, which is another one. I use the ones that I find most helpful, and I think I use the one that has the most data. And that's how I practice integrative medicine. The second type of category is mind-body interventions. This can be anything from biofeedback, which is really up and coming cool therapy that we prescribe in integrative medicine. It's coming up with a lot of data, guided imagery, meditation, believe it or not, prayers. So all that is actually part of intervention and how we practice. Biologically based treatments, these can be herbs, botanicals, vitamins. These come in a bigger category just called dietary supplements, which is part of that. Manipulative and body-based methods, they've kind of talked about massage before, OMM, chiropractic, acupuncture. These are all things that you could do in integrative medicine. Energy therapy, so this is therapeutic touch, Reiki, Qigong. There's lots of other techniques that we use in energy therapy. What are the advantages of this technique? So one, it's patient-centered. You know, kind of what I mentioned, patient perspective is key here, right? Because what is I'll give you a quick example. I have an Indian background. You know, when it comes to things like hypertension and heart disease, one of the most studied diets that we have is something called DASH diet, right? Now, if I am prescribing DASH diet to my Indian grandma and asking her to eat lean turkey and broccoli, how effective is that going to be? It's not going to be effective at all. We're wasting everybody's time, right? Because there's no way that she's going to be able to eat any of that. So this is why it's really important to understand your patient before you're prescribing any therapy, right? It's evidence informed, kind of what I talked about. You're looking at the evidence that we have. Sometimes we don't have much evidence, and that's okay, but that's how you guide patients, right? And you also are rating the harm. So it is not that supplements have never caused any bad outcomes. They have. In fact, there's a lot of supplements and a lot of contaminants within those supplements that are actually really harmful. And partly why that's happening and is because we don't have a good regulatory body that kind of looks at the quality of your supplements when it's prescribed. We do have some guidance and some regulations, but it's just not there yet. One of the biggest differences between a dietary supplement and a Western pharmaceutical is that your Western pharmaceutical needs pre-market approval, right? Which means it goes through rigorous testing before it actually is introduced in the market. That is not the case for dietary supplements. That does not mean that it's not regulated. It's just not regulated in the same way. Now, if a dietary supplement says, you know, we have 1,000 units of vitamin D, for whatever reason, let's say I have a lab at home, which, you know, kind of the nerd that I am, right? I just happen to have a lab. I am joking about that. But let's say if I have a lab at home and I test that vitamin D product and I say, hey, the units that the product mentioned is not accurate. It's 2,000 units, which happens commonly, which is one of the problems with dietary supplements. Well, that is a reportable thing, and that company can face a lot of serious consequences from it. But because for the most parts, we don't have labs at home, there are other ways of actually looking at the quality of product, which I won't go into detail, but if anyone's interested, we certainly can. But there's a lot of things in integrative medicine. Once you're perfectly, or once you're well trained, you have that knowledge. It is team based. So in my practice, we have a nutritionist, we have a psychologist, we have a yoga teacher, a wellness coach. So we're all talking and communicating with each other. A lot of times in the real world, you're never really going to pick up the phone and talk to somebody's psychologist. And we know that mental health is so important for physical health. And, it's a little bit of a shame that we don't. And I hope in the future we do. It really improves compliance. So in integrative medicine, we use a technique, a counseling technique called motivational interviewing, which time and time again has shown that it's better than conventional advice. Motivational interviewing is this idea that you are looking at patients' perspective, but really you're empowering them to make the decision rather than patriarchal advice. Hey, you have, you need to quit smoking or you'll die, right? The truth is, when we give that direct kind of advice, a lot of times it is not useful, is because the truth is most patients know that smoking is bad for them. And simply saying to them, hey, if you don't stop smoking, you're going to die. They haven't been living under a rock, right? So that kind of direct advice is sometimes not useful. So what you want to do is empower the patient to come up with their own understanding. Well, yeah, let's say if you're counseling a patient and they say, well, I know that smoking is bad, but I use it because of stress relief or XYZ reason. It is them that is coming to that value that they're subscribing to smoking, right? And it is your job to then counsel them and guide them in the right direction rather than just giving them direct advice. It can be cost effective. If you look at the amount of financial burden that we're facing from hospitalizations, from things like heart attacks and strokes, it is really, really key to start prevention early on. And that's what we focus in integrative medicine. And lastly, you want to keep an open mind. If you see what's happened in the last few years with the pandemic, we have realized that we don't have all the answers in Western medicine. We had a disease that had so much mortality, caused so much mortality and morbidity. And I think with an integrative approach, you learn to keep an open mind. This is a research study that was done out of the Cleveland Clinic that looked at conventional care versus integrative care model. And this is kind of a study that's near and dear to my heart because it kind of shows that when integrative care was provided, it was superior than conventional care. And they looked at something called the PROMIS scores, which is patient-reported outcome measurement information system, and global health and measure score. So this is a pretty standard tool that we use to see how our patients are feeling. And both at the 12-month mark and I believe at the 6-month mark, integrative and functional care did a little bit better than conventional care. So I get a lot of physicians that ask me, well, why should we care? We don't have good data for this. We don't have the right research ongoing in these fields. Why should we care about any complementary and alternative medicine? And here's the reason why. The simple answer is because your patients care. It doesn't matter if you feel that this is completely useless or if you feel like this is something that you will never prescribe, that's okay. But learning about it is important because this is some data that kind of shows you in 2020, the sales of dietary supplements, which is over the counter, and before I go through the statistics, I'll tell you that when I was in medical school and residency, and I'm an internal medicine doctor, when patients would show me this long list of supplements they were on, I would accept the paper. And the next thing that I would do is I would crumple up the paper and throw it in the trash because I felt like I had no knowledge, right? So if I can share anything, is that your patients are using these things. So it's probably prudent for us to learn about these things, even if we don't care about them individually. In 2020, over $190 billion were spent on dietary supplements. That number is actually going to increase, and it's projected to be 307 billion by 2028. Sorry, just give me 1 second. Okay, now the other statistic that I think is interesting is that 33% of adults in the United States are actually using CAM therapies, which I told you guys is complementary and alternative medicine. Now, what is even more scary, that 42% of your patient population, and if somebody, primary care physicians are sort of the gateway, 42% of them will never share that they're actually, or never discuss that they have this other part of their life that they, get CAM therapy, and that will never be discussed. And one of the reasons why I think that is true is because we have no interest as physicians in these complementary alternative medicine, and the interest is also not there because we have no training. So I think it's really sad when I think about 40% of patients, and that number might even be actually on the lower estimate, that they will never discuss to have this other part of their lives and are not even willing or open to share it with their physicians. In 2018, 77% of Americans 18 and over were actually on a dietary supplement. And I think that number is pretty darn insane, right? In the age bracket 35 to 54, it was 81%. So I think this is why we should all care about this, right? I'm just going to point out a couple of these pictures. So this right here, this lady is getting what is called cupping. Michael Phelps, when he was he talked about it a lot during his training. And, it's funny that it takes a celebrity sometimes to talk about these therapies and then it becomes popular. But cupping has a lot of value, especially when it comes to sports injuries and improving muscle health. This is sound healing, which I think is probably also highly underutilized. I find it funny that we actually use sound so much in conventional therapy, but we just don't call it sound healing. A good example of that is ultrasounds. Ultrasounds have been used for diagnostic and therapeutic purposes for a few decades now. We don't think of somebody using a music bowl and equate that with ultrasounds, but this is the power of sound. And if you talk to a sound healer, they'll tell you that when you find that right vibration, that right note, that right frequency, that's when magic happens. Because if you think about it, the guiding principle is that all of us are made up of matter, and matter vibrates. Vibration creates sounds. So in your internal body, there's a beautiful musical orchestra that's going on, and we just have to listen. And this is what sound therapy is trying to do, right? This here is Reiki. Reiki's, there's different types of Reiki. There's hover Reiki, there's touch Reiki. It really, the guiding principles rely on energy medicine and connecting with physical touch and really optimizing the frequency between a Reiki practitioner and the client. This here is called moxibustion. This is where you will burn an herb called artemisia for its therapeutic purposes. It's used in traditional medicine in Asia a lot, in a lot of different countries, and it's been helpful in relaxing, reducing stress, lots of different reasons why traditional medicine practitioners use it. Now, this is a list of herbal supplements in the United States, top 10 top selling herbs in 2020. This is, the first one is called elderberry, and I don't know how many people are familiar with this, but it's used a lot in upper respiratory infections and things like cough and colds and whatnot. Now, second one is something called Horehound. I've done this lecture, I think probably like 10 times now. I've done it for internal medicine residents, I've done it for family medicine residents, I've done it for psychiatry residents, and for medical students. Anytime I ask people, hey, who here has heard of Horehound? 0 hands have gone up so far. Interestingly, in 2019, Horehound was actually the #1 selling herb. So again, just to show that how far removed we are from some of these herbs and botanicals, right? I mean, this is the top selling herb, and I'm not talking about in the world, I'm talking about just in the United States, right? I'm not going to go through this whole list, but I'm sure some of you have heard of some of these things like cranberry and turmeric. Turmeric is a very popular one, and it's used in things like inflammation. Now, that said, these herbs have varying level of evidence. As integrative medicine providers, what we do is try to figure out which ones have more evidence and how harmful these are. So I'm not saying that, if you take cranberry juice, then your UTI is going to go away. I'm not suggesting that. But what I am saying is that when we are using an integrative medicine approach, you look at what the guiding evidence is. You also look at what is the harm of sipping on some cranberry juice when you have a urinary tract infection. So how do you apply this in clinic? This is the mission statement of my practice. It is to help facilitate team-based integrative medicine. We believe with love, kindness, and support, we can conquer anything together. This is our 6-pillar approach. We rely on nutrition, exercise, mind-body practices, supplements and herbs, Western medicine. Believe it or not, I still am a trained MD, so I, sometimes we'll use Western pharmaceuticals, complementary healing. This is what a 6-pillar approach in the practice looks like. I thought I would just probably do a case at this point to kind of show you guys how we practice in real time. So this is a 25-year-old with history of hypothyroidism, PCOS, which is polycystic ovarian syndrome, celiac disease. She presented with bloating, abdominal pain in the bilateral lower quadrants, cramping, weight gain, and insomnia. Now, these constellation of symptoms are not very uncommon. A lot of us have digestive health issues, and this patient happens to come for that. She tells me that she has a very poor appetite. She has early satiety, intermittent nausea. It fluctuates, her bowel movements fluctuate between diarrhea and constipation. She feels bloated almost on a daily basis and with most food groups. Now, that line right there in that question stem in this case, and of course, this is a real patient, that is a very powerful statement right there, because she's feeling bloated on a daily basis and with most food groups. Now, as you can imagine, somebody with celiac disease, which is an intolerance to gluten, which is found in wheat products, right? Somebody that's already on a very restrictive diet, and when they come to me and tell me that we are feeling bloated with almost every food group, red flags go in my head, right? Something is happening in this patient's life that we need to dig deeper, because you are already on a very restrictive diet, and she's very, very good about making sure that she has no gluten in her food. And here we have a patient that's coming in with all sorts of digestive health issues, and she's finding that most food groups are causing that imbalance. So that part right there is very telling. She's gained over 12 pounds with no change in diet or exercise. She has constant feeling of anxiousness, sadness due to her digestive issues. Her stress level is 9 out of 10 because she is actually an ICU nurse, and she's also in graduate school. She's getting her doctorate in nurse practitioner. Her sleep is pretty bad. 5 to 6 hours is not a healthy amount. We know that, there's a lot of research coming in that if you're sleeping less than 7 hours, you have an increased risk in all-cause mortality, whether it's heart disease or stroke or whatever, what have you, but you have an increase in risk. And I think that's really important, because I would say most of us are not sleeping the recommended amount, which is 7 to 9 hours. And I think that's a problem. Now, she has difficulty in maintenance and initiation. That means she's, number one, having a hard time sleeping And even when she does sleep, she probably wakes up and she's tossing and turning. So she's having issue in both. Now there's all sorts of ways of actually, even if you're sleeping the number of hours, that doesn't mean you're getting good restorative sleep, because we have all this new research coming in sleep architecture and optimizing the time that you're spending in REM sleep and also deep sleep. We're not going to touch upon that, but just so you know that not just number of hours, there's also other things that you want to look at when you're doing a good sleep health history. And I think we'll go over some of the guidance that we gave this patient. Alrighty, so these are sort of the treatment plans that we made for this patient. Now, the first thing that we did was enroll her with our therapist in a psychotherapy program. Specifically, we are doing something called cognitive behavior therapy for insomnia, which I'll talk about in a couple of slides later. Now, we also uncovered that the patient had an eating disorder. Now, that's very, very important, because oftentimes we don't take enough time to talk to our patients and really understand psychologically what they're going through. Remember that this patient had she had digestive issues with all food groups. That to me is very important in this question stem, because you have somebody with restrictive diet who's gaining weight, who's stressed, who's anxious, who's not sleeping, who's working in a very, very high level stress environment. It's kind of a no-brainer in some ways, but this is how coming to the root cause is important, because there's clearly something going on. And to be quite honest with you, I would say her digestive health issues today are probably a consequence of what her life has been in the past. So she clearly had an eating disorder in the past, and then those things are connected. Those are not mutually exclusive things, right? So we started her also on a weekly candlelit yin yoga class with our wellness coach. We prescribed her 2 different breathwork techniques that come from yoga, which are called pranayam, which is the term for breath work. So one of them was called breath of fire. Now, it's interesting that Yogi wrote about healing the digestive system, your gut, your liver, even before they knew some of these fancy diagnoses. I'm pretty sure they did not know what celiac disease was. And another thing that this patient probably has, and through the question stem, I can tell you something called irritable bowel syndrome. She probably has both of them, which is what her diagnosis is. I'm not taking a lot of time to go over diagnoses, because I think it's a little too, it might be too much for your guys' level, but she has something called irritable bowel syndrome. Now, yogis wrote about this without knowing any diagnoses. They didn't know what these things were, but they knew that breath work and meditation and physical movement can change things. So breath of fire just happens to be one of them, where the abdominal muscles are really involved when you're doing this breath work. It is not a very easy one, I'll tell you. It's not something that, I'll teach you this breath work and by Tuesday you'll be doing this for 20 minutes. It doesn't work like that. It's the same thing when you first start going to the gym and you run your first mile and you have a hard time, but then by month 6, when you are really, really dedicated and you're working out and you're running every day, and now you're running 2 miles, no problem. So you can go from 0 to 100, right? Some of these techniques are not easy. We also taught her something called the alternate nostril breathing, which is also one of the core pranayams, I would call it. And it really is to balance the left and the right, the yin and the yang. It is to really get people less stressed, and that's why this was an important one for her. It also works well for people that have sinus issues. She does not, and respiratory issues. Now, if you think about how intelligent the yogis were, when you think about how we breathe physiologically, we know this now, and I don't think we did back then. When you're breathing, we breathe in an ultradian rhythm. That means about every 120 minutes, one of the nostril is actually inhaling a little bit more air than the other, and that flips, right? So they are using that basic physiological role that we know exists in our body without knowing anything, and they knew that it worked. Now, the other thing that she did in part of the mind-body medicine practice was something called dream work and dream analysis. This is not a standard thing. This is only something that we do in our practice. And and shortly when I come to CBTI, I'll explain why we use a lot of dream work and dream analysis. Now, This needs to be done by a therapist. I don't do this personally myself. You need to be trained in this. You can't just one day say, hey, let's talk about your dreams and figure out all your life issues. It doesn't work exactly like that. All right, so this is my cute dog here. His name is Watson, and the CBTI program that we have, it's called the Watson-Chaudhry Sleeping Method, and I'll explain to you why. When I first got Watson, I realized that Watson prioritized his sleep. He would sleep in my arms, he would sleep on the couch, he would basically sleep anytime, any moment that he had available. And he was like, okay, I need to sleep now. Don't talk to me anymore, right? And here you see a picture of him sleeping in my hands. So this is something that he did on a regular basis. So what is the difference between Watson and a lot of America? You know, a third of America, and in some statistics, it's probably even more. Maybe 50% of America, 30 to 50% of America actually has a sleep issue, that they can't sleep, difficulty sleeping, insomnia, right? And I would argue the big reason of why this is happening is because we don't prioritize sleep. We live in corporate America where we value efficiency, productivity, energy drinks, caffeine, right? Those are things, right? What are we going to do in the wake state, right? When that happens, when you're thinking about the wake state so much, well, by definition, you're not prioritizing sleep. And it's very interesting. I'll ask my patients sometimes, why do you think you need to sleep? A lot of answers that I get, well, I have an important exam coming up. Can't do horribly on it. I have a wedding to attend. I have a presentation, XYZ. So the thing is, when you are prioritizing that wake state and everything that you need to accomplish in that, how are you going to prioritize sleep? So this is where cognitive behavioral therapy is very helpful, because it's trying to reframe and restructure that narrative around sleep. Well, you need to sleep because you need to sleep, because that's what your body requires. It is a state of replenishment. It's a restorative state that you need to have. And it's not because you need to do well in the wake world. Think about how you're going to optimize your sleep and concentrate on thinking about how you're going to do that. And I'm not going to go through all these things. There's stimulus control therapy, there's cognitive restructuring, something also called sleep restriction. I'm not going to go into detail of that, but I think if one thing that's very, very effective is actually sleep restriction, and I know it's counterintuitive. How are you getting better sleep by restricting sleep? Well, it is to get them on the schedule of a good sleep, and then shortly in the program you get the number of minutes and hours better. Relaxation training, sleep hygiene, circadian entrainment. But the only thing that I'm going to talk about is dream journaling and dream analysis. This is an important part of prioritizing sleep, because I would argue that if you are not asking your patients about their dreams and you're doing an insomnia or sleep intake, you're doing it incorrectly, because dreaming is integral to sleeping. And if you're not asking your patients about their dreams, you're doing an incomplete job. And let me give you an example. When you guys were kids, and let's say you're 8 years old, or your cousins or brothers or whoever, or siblings, or if you have kids, right? When a kid wakes up from a nightmare, right, and the parents then ask them, "Hey, tell me about the nightmare. What did you see? What happened?" And that soothing process that happens. And shortly after that soothing process, the kid goes back to sleep. So this is important. This is important not when you're 8, but when you're 58 too. So this is why talking about dreams, and if you have a recurrent dream that comes over and over, and premonitions and all that stuff, you're not trying to overanalyze, by the way. You're not trying to, nobody knows. We have speculations of the significance of dreams, but no one knows the exact reason why we dream, right? So you're not trying to overanalyze. You're trying to really just, one, prioritize sleep, because you're talking about the sleep state. And second, you're trying to figure out, are there any things that are bothering you in your psychological state? That's all you're trying to do. Again, that's why you don't do this with, dream journaling is easy, because that any doctor can recommend. But of course, if you're getting more into the dream analysis stuff, you need a trained psychologist, because you don't want any psychological breaks that happen during these sessions and whatnot, and then something that we're not trained for, right? Nutrition. So low FODMAP guidance. I don't know if you guys know, but this is one of the first-line therapies treatment that we use for something called irritable bowel syndrome. This is not a lifelong sentence. These are fermentable carbohydrates that we are trying to reduce for a short period of time to make patients feel better, get their gas, bloating, and stuff like that better, and then eventually be less restrictive. But again, in this patient, of course, it's a difficult decision because she has a restrictive diet. You don't want her to you don't want her to restrict completely and entirely to the point where she's not eating anything. But I think it's an okay advice to be given in the short term. Increasing diversity of and colors of fruits and vegetables. I think this is really important. There's a lot of big population studies that talk about how fruits and vegetables are good for chronic health conditions, including digestive health, including diabetes and obesity and strokes and whatnot, autoimmune disorders. But the more problematic thing I would say is when you look at the recommended daily allowance that is proposed by the Institute of Medicine and the FDA, 1 in 10 people in the United States are actually eating the recommended amount of fruits and vegetables. That I think is a huge problem. We have an incidence of autoimmune disorders that are going up. We have an incidence of cancer, colon cancer in particular too, right? And a lot of this has to do with the foods that we have been eating and consuming, because it is not that in the last 50 to 100 years that our genetic pool has changed. That is not enough time. So something has changed in the environment. And one of the things that we do ubiquitously is eat. And we know that there's a lot of additives and processed things in our packaged foods. So that is a huge problem. So I think this advice probably is good for most every patient in the United States. There's also this new and upcoming field in the world of dietetics and nutrition that talks about the role of phytonutrients, which are only present in plants and fruits, right? Because phyto is coming from plants. So I think we're going to learn a lot more about why fruits and vegetables are so good. Increasing fiber, specifically soluble fiber. Of course, she was avoiding gluten anyway, so that was part of the recommendation. Now, the next thing is increasing B vitamins, magnesium, and omega-3. We know that not only in the United States, when you think about it, especially amongst young people, this happens all the time. We're like protein, and macros. We got to reduce the carbs, this and that. Everybody's talking about your macronutrients, right? That's a problem because there's also all these micronutrients, again, which are found, a lot of them found in fresh fruits and vegetables. Not that it's not, some of them are also present in meat, but a lot of them are found in fresh fruits and vegetables, which our intake is so low. This is a problem because it is not just your macros that are playing a role in things like stress and chronic health conditions. It's also, it is also micronutrients. So optimizing those are important, and getting them through a well-balanced diet is important. We also know that a lot of hormones that are responsible for things like stress, depression, lack of, insomnia, things like serotonin, melatonin, they require these cofactors. So when you are depleted in things like B vitamins and magnesium and all that stuff, you are devoid of the cofactors. Now, there are also concerns with not only just the diet, but with our current lifestyle. Things like alcohol and drugs and Western pharmaceuticals actually deplete a lot of these micronutrients. So we also need to be mindful of that, right? One of the biggest offenders that I find in my practice is this medication that's over the counter that's called Protonix or pantoprazole or omeprazole. These are a class of medications called proton pump inhibitors. Almost everybody that I see these days is on some acid lowering medication. Now, what are the side effects of this? Well, it actually depletes your B vitamins. It actually depletes your magnesium. Now, these are all things that are required for a healthy brain and stress and whatnot. So these are things that we really need to be mindful of. Guidance on processed foods, kind of touched on this already. Now, another term that I'm going to uses something called endocrine disruptors, or EDC, endocrine disrupting chemicals. This is not a music festival somewhere out in the desert, I promise. This is a real term that is a real problem, because a lot of the food that we're eating that is coming out of packages have these added ingredients that are placed sometimes for taste, sometimes to increase the shelf life, sometimes, there's lots of different reasons, but primarily being shelf life is one big concern. Now, in a lot of lab research, we've seen that these same chemicals are actually responsible for messing up our endocrine system. And that's the hormone system in the body, right? These things need to be taken into account when we are eating out of a canned container or plastics and whatnot, right? These are things that can mess up, and especially, small amount of poison over the long term is still poison, and it's still going to affect your body. And that's why getting some guidance, kind of early on is important. This patient is 25 years old, right? So I would argue that this is a great time to be talking about that. So the last thing is maintaining a food journal and mindful nutrition. Mindful nutrition is really important because it is really the idea that we need to improve our connection with food, right? Some of the most basic components of mindful nutrition is take your time with food, enjoy the texture, the flavor, give it respect, the food that's presented in front of you, right? Don't talk about politics, don't watch television, don't look at your phone while you're eating. Give yourself enough time, taste the flavors, try some new ingredients, right? That's the core concept of where mindful nutrition comes into play. I'm not going to go through this. This is just kind of an idea of how you make these hormones that are responsible for a lot of sleep issues and mood disorders. And if you see, again, micronutrients are responsible when you create serotonin and melatonin. I'll skip this one as well. This is just, again, a research study that talks about how you can use micronutrients in mood disorders. This study actually finds that use of micronutrients is, there's a role in things like ADHD. And I'm sure you guys know how, how prevalent ADHD is, and how many patients that get diagnosed actually get put on pharmaceuticals that are not necessarily safe. This is, again, a very amazing study. That was a 12-week study that looked at the role of nutrition in depression. And they saw that when you had patients on, or not patients, but at least the participants, when you had them on a modified Mediterranean type of diet, in 12 weeks, you had 32.3% remission. That is huge. That is huge that you had a third of the patient, the participants that went into remission from their depression. So that is the power of nutrition. When, in Western medicine, when we get a result of 10, 15, 20% in any outcome, we get really, really excited. So here we have, almost a third of the participants here. Because of lack of time, I'm not going to go through all of this. I think writing an exercise prescription is an art. It really should be more outlined. You shouldn't just tell people, hey, go diet and exercise. You really should write a script for that. And this is some of the things that we use in how we write a prescription. We put her on some dietary supplements: fresh ginger, peppermint oil, psyllium husk, which is a soluble fiber. And then we put her on some sleep herbs, things like valerian root, chamomile, hops. Hops are the same things that are found in beer. Is it an herb? Lemon balm, passion flower. All right, I'm going to skip this as well. This is just a seminar that we did for stress in the workplace. There are a lot of issues in integrative medicine. A lot of them have to do with regulations and standardization of the field itself. Training in nutrition is lacking. And I think if you've learned anything today, that nutrition and food as medicine is important, and you've seen how effective that is in helping with chronic health conditions. This is a survey study that comes out of where they surveyed cardiologists. So out of that came out that 90% of cardiologists said they received minimal to no nutrition education during their fellowship. 59% said they had no nutrition education during their residency. Up to a third didn't receive any during their medical school, and only 8% surveyed themselves as experts in nutrition. That is, that's not great. Okay, in terms of training, there are fellowships. There are 19 training centers. There's a board certification since 2014. These are some resources that you guys can look at on your own time if you're interested in learning more about integrative medicine. And I think we are ready for questions if you guys have it.
All right. Well, first of all, thank you so much, Dr. Shiven, for all of this, gathering all of this. A lot of what you pointed out resonates with actually working at a clinic myself. I just picked up a job over the summer. I can see a lot of it reflecting just with the patient care I see day in, day out. Specifically when you mentioned prescriptions, that resonated a lot because the doctor I work with, he writes up everything line by line, step by step, instead of just verbally telling them. It keeps them a little more accountable. And let's say they are even an accountable person, at least they won't necessarily be confused as to what they need to do, or they might otherwise feel like they're bothering the doctor. They don't necessarily need a reference to him. They just look at what he gave them. So a lot of great details here. I'm very glad that we had you for the session today, just to end off the term. What a great end to it. Just to go over a few questions, if you don't mind, with the time that we have. Our first question is from a student asking, what kind of schooling does this field entail? I know that you mentioned a number of practitioners are involved, physicians, MDs and DOs, naturopathic practitioners, and more. If you want to just speak on your schooling, that's all right. If you want to speak on others.
Yeah. I can only comment on the integrative medicine side when you're a physician or MD or DO. There's extensive training on, people that pursue naturopathy or Ayurvedic schooling. I don't know the first thing about how many years and whatnot, so I can't speak on that, but I can tell you, so I did 4 years in pre-med, 4 years in medical school, 3 years in residency, and then 2 years in fellowship. So that was my training. And that's, then you can take a board exam at the end of your fellowship and get a board certification in integrative medicine, similar to how I got my board certification in internal medicine.
Our next question is from a student saying, with the current knowledge you have about integrative medicine, would you have considered going to DO school in hindsight?
That's a great question. I sometimes think of that because I think, learning some OMM principles would have been a great idea. I certainly think that could have added a lot of value to my training. But I do think, things are supposed to happen how they're supposed to happen. I think it would have been great if I had gotten that training, but I'm happy with where I'm at, but absolutely that could have been a great addition to my practice. And somebody that is interested in integrative medicine, that might be a good route to take.
Definitely. A great question there. Maybe we can wrap it up.
One other thing that I wanted to point out, in DO school, you don't necessarily get any of this training though. While you get some elements that are certainly, I think with OMM being one of them, that is certainly something that they talk about. Not every DO school is going to go through concepts of Ayurveda or traditional Chinese medicine or acupuncture.
Yeah, curriculum definitely does vary between school to school. Maybe we can just end it off with 2 more questions. Going back to what you mentioned about the case, you talked about how the patient didn't really have a great sleep schedule, and they struggled with both initiating sleep and having good sleep quality when they would actually get around to sleeping. So how closely in general do you work with sleep specialists? Actually, the clinic I work at is a sleep lab. So I was just particularly interested in asking.
Sure. So the short answer is, when you send somebody to a sleep lab, you're really curious about, the sleep study. Now, when I'm dealing with insomnia, there's really no role of sleep study in insomnia. If I was worried that a patient has narcolepsy or obstructive sleep apnea, or some REM behavior disorder, I would refer them to a sleep lab for that reason. You don't need a sleep study particularly to diagnose insomnia, which is the good part. Now, what I'm interested in is the sleep architecture. Now, as you know, these wearable devices that we have, these days, whether it's your Apple Watch or Fitbits and whatnot, we certainly use a lot of that to optimize sleep. Now, sleep study is probably a better way to look at sleep architecture. And the truth is the technology of these wrist devices are probably not as good. But with a good clinical history, a good sleep journal, a good sleep diary, and with the help of these wearable devices, we can actually get a pretty good idea and sense of how the sleep quality is. So the short answer is I would only refer somebody to sleep lab if I was worried that they have something else that is not just insomnia. But to look at sleep quality, these are expensive tests. You don't want to have the patient go through all this testing when we can fix it through other means anyway. And for me, the wearable wrist devices are good enough.
To end off on our last question, that's going to be about the comparison you see between integrative medicine in the US and overseas. How common would you say it varies in each?
This is an interesting question because, of course, when you go to India, there's these so many Ayurvedic schools that are talking about integrative medicine, and I think some of the other countries, like for example, Germany, I think does a lot better when it comes to integrative medicine research and giving out particular guidance. In the German Commission actually does a pretty good job in giving out particular guidance in dietary supplements and herbs and botanicals. Not to say I think we're far behind. I think we're using integrative medicine every day of our lives. I think the structure is missing for sure. And I can't really comment so much on other countries. I would say that we need to do a better job just by the number of people that are consuming integrative medicine. I think that alone shows you, that we ought to just change our practices and really get more training in the conventional medicine system. I don't know how the schooling is in other countries. Are they talking about it or not? I'll tell you, I work at University of Nevada, Las Vegas. I designed the integrative medicine curriculum for the medical students, and I also teach integrative medicine. I think that is one step. We're one step closer in realizing how crucial this is. And I hope that more and more, I know in Southern California, when you look at institutions like UCLA, UCSD, UC Irvine, a lot of these places have their established integrative medicine centers that are incorporating Western and alternative methods. And I think the demand's going to go high. I think at some point, most academic centers are going to want to have an integrative medicine center, which is not so apparent today, but maybe by the time you guys are done with your training, we'll be having a different conversation.
Well, I think that's a great way to end off today's session and off the semester. I want to thank all of y'all for joining us this semester. We'll be back with more sessions in the spring. Just some last reminders for those who want to earn credit for their attendance. So to earn credit for your attendance, you must pass the quiz, and that quiz is now posted in the chat box. It's not yet available on our website, so we'll be updating that soon. But just go with the link in the chat box and it will direct you to a Google form. It has 10 questions total, 6 or more are needed to pass. And that's all. Once you do pass, you'll receive a certificate, and that certificate will be sent to the email address that you list on the quiz. Be sure to list a personal Gmail or Yahoo email for the best chance of having no problems with it being directed to spam. In case you don't find it in your inbox or your spam folders, feel free to shoot us an email and we can help retrieve it. And this quiz will be due next week on Wednesday, December 28th at 11:59 p.m. Central Standard Time. Like I said, this wraps up our fall 2022 term. We'll be back in the spring on January 23rd. That's going to be our first session for spring 2023. In the meantime, though, If y'all are interested in getting yourself involved with Hearts for Health, we do have applications to join our team that are still open through December 30th of this year. It includes positions like our session coordinator, who actually join us on the session, and they work behind the scenes on our shadowing program. So if you're interested in getting more involved with our shadowing program, you can apply for that position. And there are a couple more that are involved with our other programs to do with mentorship and volunteering, specifically as our project developer. So our session coordinator works with shadowing, our project developers work with all other programs. For more information, you can always email us at shadowing.h, the number 4h at gmail.com. And that will wrap it up. Like I said, Dr. Shiven, he had his contact, I believe, in his handle. So if any of y'all want to give him a follow or just check out his content, feel free. And I mean, he took his time to get this session together. So let's hear some thank yous in the chat for Dr. Shiven. This was such a great session to end off on. And I honestly learned a lot personally. I can definitely say that on behalf of the students, they probably also learned quite a bit too. I'm really glad that we had this session put together, but I really hope that everyone enjoys the rest of your night. Enjoy the holiday.